to the EMA Modernizing Medicine Component Overview. In this training, we're going to talk about EMA, which is the medical record system. Overall, with EMA, you're going to be able to look up patient information, send messages to clinic staff, turn on and unlock the patient portal, view patient charts, and request medications. EMA is an electronic medical record tool that's used here at FiNet clinics by the employees to manage patient care and records. In this system, you will be able to view patient histories, send messages to clinic level staff, as well as manage patient portal activations. This is what the common home loading page for EMA looks like once you've pulled up a patient. This is your home screen, and there are several different components on the screen that we're going to be looking at today. The first component is the search bar at the very top of your screen. Now here at FiNet, the way we search for patients is always by using the patient's date of birth. So we're not going to look the patient up by name or even medical record number. We're going to look them up by their date of birth. So that's a 2-digit day, 2-digit month, and then the year. Off to the right of the search field, you're going to see that there's a little icon that looks like a clock with an arrow going around it. Now this icon is the button that will let you pull up the last 10 patients that you have looked at. This can be very helpful in situations where you may have forgotten to take note of the patient that you were working with earlier and need to follow back up on something that you were doing for them. This next section right below the search bar is the ribbon. And on the ribbon, there are several different links that you can click. However, for the contact center purposes, the main one of these links that we are going to be worried about is the tasks. Now, tasks are another way of talking about messages and messaging here at FiNet. This area on the ribbon is where you will click so that you can see when someone has sent a reply to a task that you have sent over to the clinic. As you notice, there is a 1 above tasks right here. That means I have one message waiting for me where the clinic has responded to a message that I have sent over. When we get into tasking on another video, we'll go a little more in depth into this. The next area is going to be the patient banner. Now this patient banner basically has a lot of the demographics and information for this patient. As you can see here, I have the patient's name, date of birth, allergies, their phone number, their birth sex, the medical record number. It also tells me whether or not their patient portal is active. And you can actually activate it there as well, but we'll get into patient portal in a different video also. Notice at the bottom of this bar, there is a little downward facing triangle, an arrow pointing down. And if you click on that, it's going to bring up some even more information. So you can see this little drop down menu appears, and on it you can see who the patient's preferred provider is, their PCP. If they were referred, the referring provider's name. You can also see some of their insurance information. You can see their address. Another important one is going to be the preferred pharmacy for this patient right here, you can see it's CVS. That's something that you want to take note of because you're going to need that a lot when you're working with medication refill requests. On the far right-hand side of that patient banner, you're also going to see several different buttons, including the call, select room, enable kiosk, and create task. Of these buttons in this group, the only one that you will use in a contact center is the create task button. And that's how you're going to start to create a task for the specific patient that you are dealing with. Again, we will get more into tasking and messages on a later video. The action bar has plenty of buttons. There's only one that ever really interests us here in the contact center, and that's the edit patient data. It's not much that we do here. However, there are some options in this location that you can use to edit, to unlock the patient portal and things like that. On the left-hand side of the screen is the left nav bar, navigation bar. Now there's several different links here that you can go to, but only a few of them are really relevant to your job as a phone agent. The first one being the RX history. RX stands for medication, and this is the medication history where you can see medication that has been written for this patient and find out if there are refills and things like that. You also will see that there's a chart notes link here and a visit summaries link. You can go to those links so that you can see previous notes that have been put in by the providers talking about their visits, the patient's visits. Other things listed here that you may want to look at include the task button. You'll see that there's another task button right here also. And that's one where you can go to look and view tasks that have been sent over by yourself as well as other people for this specific patient. You never want to send over another new task if there's already a task that exists from another representative. So you always want to make sure you're checking tasks here first before sending over a new task. The next section is the patient clipboard, right in the middle of the screen. And this clipboard has a lot of just some background synopsis information about this patient. You can see that there's some medications that they're on. It talks about some of their past medical conditions that they've had, skin conditions, family history, so on and so forth. Off to the right, middle, you'll see that there's a space for upcoming appointments. In this space, you can see appointments that are coming up for this patient. However, I want to remind you as you get into this that ECW is actually the system where we verify appointments, not here in EMA. There are times when there may be delay or a communication issue between ECW and EMA where the appointment time and date here may show up, but it may not show up in ECW because it's already been canceled or something else of that sort. So we never want to use this as a verification tool to tell a patient when their appointments are. We'll actually go over to the ECW system for that. And next is the patient activity section. Now this section shows you previous appointments that this person has had, and it has all of these. You'll see that all of these blue letters those are links, and these are links to different visits that the patient has had. You can see here that they had one on the 15th of January, one on the 17th of August, one on the 17th of February, 2020, and then back down there, the last one was on 19th of November in 2019. Now, if you were to click on any one of those dates, it's going to pull up the chart notes that the provider put in for that particular visit, talking about what they did for that patient, what they came in for help with, what their plan of care was, so on and so forth. That can be important because there will be times when, one, you may need to find out how soon the patient was supposed to return for the next visit. It may also tell you some good information about the medications that were written or were not written and things like that. So going to the chart notes will be something that may be very valuable for you when you're taking calls for patients. Now that's a basic overview of all the components that you're going to see in the EMA system. We are going to have a few other EMA training videos here as well, where we'll go a little more in depth into some of these things, and then we'll have a lot of practice as well so that you can go through and practice your skills. Thank you.